Olá, pessoal. Agradecer aí a presença de todos. É, Daqui a pouquinho o Dr. Ali ele vai entrar aqui para a gente começar a nossa conversa. E hoje a gente vai falar um pouquinho sobre cabelo, sobre tratamento clínico de transplante capilar e sobre tratamento cirúrgico também do transplante capilar. Vamos só aguardar aqui. O Dr. Ali ele já tá presente. E eu vou tentar fazer as conversas. A gente conversa em inglês e depois eu vou traduzindo para ele. Hi, Dr. Ali. How are you?
Hi,
Hi,
Hudson.
my
How are you?
friend.
I'm fine. How are you?
Fine, thank you. Good to see you.
I know, I know. What time is it there?
Here is midnight.
Oh my God. You have people
Yeah.
watching at midnight.
No, no problem. I I have a confusion with
The timing.
yeah, with the time,
Okay.
but okay, yeah,
We have to adjust. We have to do maybe the next time at about maybe 8 p.m.
yes,
your
yes,
time. Yeah.
yes. I thought that is like 12 a.m., but is midnight, so confusion, but no problem.
Okay, no problem, no problem, no
Well,
problem.
but the good thing is that we have like 10 people watching live yet. So,
Well, to
yeah,
be fair, it's not 11 here yet, so hopefully some of them will wake up and join us for a little bit
yeah,
of chit
yeah,
chat. Yeah. All right.
yeah. Pessoal, então eu vou. I will make the questions in Portuguese, so I translate this for you, okay?
Okay, all right, all right.
Okay, okay,
So
yeah,
fine. So
okay.
how is it? How's everything in Brazil? How's the COVID situation and everyone's going around? Is it okay?
Yeah. Então, o doutor Ali está perguntando para a gente como é que está a situação do coronavírus aqui no Brasil, né? Se está ok e tal. Well, it's not good. I think we have maybe we are now in the peak of the disease,
Mm-hmm.
and we are waiting for this pass. But so
But it's okay.
yeah,
Yeah.
it's a difficult situation right now in the outer world, right? Ele está perguntando
Stay
para a
strong. Stay
gente,
strong. It will pass. It will pass. So
yeah,
we are plateauing, and hopefully you'll reach us in the next couple of weeks, and everything will be back to normal, near normal, hopefully.
oh, no, cool. Ele está perguntando como está a situação do coronavírus aqui no Brasil, né? Tô falando que a gente está provavelmente no pico, mas ele está falando que, né, para todo mundo ficar forte aí, para todo mundo ter esperança que isso vai passar. Nas próximas semanas a gente, se Deus quiser, já vai estar livre disso. Falar um pouquinho, I will talk with the people about how we met and your
Yes.
experience and where are you from and your practice. So, well, então falar um pouquinho do Dr. Ali. Dr. Ali, ele é de Kuala Lumpur. Kuala Lumpur?
Yes.
Yes. Kuala
Kuala
Lumpur,
Lumpur.
na Malásia. Nós nos conhecemos em Los Angeles, num congresso sobre transplante capilar do Dr. Yilmar, que é um cirurgião de transplante capilar que é referência em transplante de cabelo do corpo, de partes do corpo para o cabelo. Então, ele aborda muito essa questão de transplante de barba, transplante de cabelo do tórax para o couro cabeludo mesmo. E nisso eu conheci o Dr. Ali, né? Nós ficamos amigos. E o Dr. Ali ele trabalha em dois países, na verdade. Ele trabalha na Malásia, que ele é de Kuala Lumpur, a capital da Malásia, e também trabalha no Vietnã. Ele tem uma grande referência lá no Sudeste Asiático, é uma pessoa bem respeitada lá, e a gente vai começar a conversar um pouquinho sobre a prática dele. So, Dr. Ali, did you do your training in India too? I
Yes.
remember.
So yeah, so I did my training. Well, undergrad was in Malaysia, but for the hair transplant was in India.
Uh-huh.
So I spent quite a long time there, about almost a month to 6 weeks there, staying
Uh-huh.
there full time. And I think the good thing was that I managed to get a lot of experience in terms of hands on,
Uh-huh.
and knowing a lot of different types of hair types over there. But since then, coming back to the own practice, I
Mm-hmm.
focus a lot in Southeast Asia, Australasia. So from Australia, Malaysia, Indonesia, Vietnam, Singapore, Brunei, I handle quite a large region of patients that fly in.
Oh,
So it's
cool.
interesting because we get a lot of different subtypes of hair and different types of
Mm-hmm. Mm-hmm.
requests. Yeah, but that's the probably the most challenging part, but it's also probably the most fun part, knowing that everyone's very different, even though it's all in just one region. We're not as big as Brazil, but once you add all the
Uh-huh.
countries, we make up pretty much like the Brazilian map for you.
Yes, yes. É, so I will translate for the people. Então, o Dr. Ali ele fez parte do treinamento dele na Índia, ele ficou algum tempo na Índia, que também é uma referência de transplante capilar lá na região. E o interessante é que ele recebe pacientes não só da Malásia, mas de toda a região. Singapura, Indonésia, Austrália. Então, o que que acontece? Ele tem a experiência de ter casos de vários tipos diferentes de cabelo, né? Porque isso é uma coisa muito importante. A gente ter uma referência de cabelos de diferentes nacionalidades, a gente tem que ter uma abordagem diferente para cada caso. Então, isso acaba melhorando a expertise dele ali em qualquer tipo de tratamento de cabelo, né? And, Dr. Ali, do you do just the manual FUE or automatic FUE? What's your experience, your practice? Say, could you tell for
I
us?
do mostly manual FUEs,
Mm-hmm.
and we've also started with the automated ones. But
Mm-hmm.
very
Mm-hmm.
largely, we still do a lot of manual.
Mm-hmm.
I try to advocate that we still need to feel touch with the hands.
Yes.
So with that, we can actually feel, are we cutting the hairs, cutting the follicles? There's actually a very different feel to it.
Uh-huh.
But
Uh-huh.
we train ourselves to move fast. So
Mm-hmm.
we
Mm-hmm.
do 4,000, 6,000 hairs per day. But everything's still very much manual. And the other thing that we
Wow.
do quite a bit would be the micropigmentation, doing the dots
Uh-huh.
on the hair.
Uh-huh.
It's getting to be quite a trend here. I'm not sure how is it in Brazil, but now it's picking
Yeah.
up. More people want to look less bald, just want to have that shaven hair look. So it helps a
Uh-huh.
lot.
Uh-huh. Eu perguntei para. And you have an experience in robotic FUE. What do you think about robotic? You think it's good or is not so good that as it seems? What is?
Well, that's just my personal opinion. I think robotic is interesting, but it is
Mm-hmm.
probably still too early
Uh-huh.
in technology. It makes it a bit complacent for the doctor.
Mm-hmm.
You
Mm-hmm.
lose that personal touch, in my opinion. We are human to human touch,
Mm-hmm.
and being the robot to do everything, I don't think there's a one size fit all. It's kind of like there's no such thing as one size fit all. So the robot
Mm-hmm.
tends to
Mm-hmm.
probably, in my opinion, tend to be okay for certain hair types, but once you go into different subtypes of hair, they may not function as well. Plus, the
Mm-hmm.
implantation
Mm-hmm.
is still some time off. It'll take a while before they can have that artistic implantation that we have.
Yes, yes. Yeah.
Yeah.
Uh, I will translate.
Sure.
Eu perguntei pro Dr. Ali a respeito da experiência dele, se ele faz o FUE manual. Aqui no Brasil, poucas pessoas fazem o FUE manual. Para se fazer o FOE manual, a gente tem que ter uma velocidade muito grande. E o interessante é que ele consegue, às vezes, fazer 3, 4 mil, 4, 5 mil unidades pela técnica manual. Né? Aqui no Brasil, dificilmente a gente encontra colegas com tanta velocidade assim para fazer isso manualmente. Né? Aqui o mais comum é o automático. Mas ele tem um treinamento uma expertise muito grande de fazer manual e consegue fazer com uma velocidade bem grande. Né? Outra pergunta que eu fiz para ele é que aqui no Brasil as pessoas perguntam em relação ao robô. E aí, o robô ele é muito bom? Você acha que é melhor o robô do que, né, do que a técnica manual? E ele me disse que ele prefere o manual porque ele consegue sentir melhor ali o tato mesmo ali para retirar as unidades foliculares e ele consegue ter um melhor resultado. O robô ele tem a indicação apenas para alguns casos específicos, não é para todo tipo de cabelo. Né? Nós temos algumas perguntas, a gente tem algumas questões, mas eu vou deixar um pouquinho para o final aqui.
You have to turn to see all the,
Yeah.
Yeah, we have some questions, but I will answer the questions in the not now. Later, ok? Yeah. Nós responderemos as questões um pouquinho mais para frente, tá, gente? Então vamos perguntar a respeito do tratamento clínico. About the clinical treatment, what do you do? It's minoxidil, finasteride. What do you do to your patients?
Yeah, so for my patients, we do a lot of still very clinically proven treatments. So minoxidil, finasteride still makes the mainstay. What we do here with minoxidil, we get it compounded, especially for patients here, because I think in Brazil, people are very into self-grooming, aesthetics. In Malaysia, it's just picking up. So over-the-counter products are not very available, so we can get 5%, but we can't get 2% for ladies that easily here. Yeah,
just 5%.
Just 5%, but that's fine. And it's only in solution form. We don't even have foam. We don't have anything else. So it's still very primitive in terms of the what we can get. So I get them compounded. So we get 5%, 7%, all the way up to 10% minoxidil in a gel form. So gel form is very good, especially for ladies. They apply, it doesn't drip, so we don't have to worry about them going and getting facial hairs from the minoxidil. Yeah, and we use finasteride. So for men, it's the standard 1 milligram per day. But for those who tend to have some amount of fear of side effects, then we'll do that compounded with the minoxidil gel. So we combine both of them together. How's it like in Brazil? Do you have those kind of combinations?
Yeah, in Brazil we have the 5%, 2%. You can talk with the pharmacists and make the drugs like the percentage that you want.
Wow, okay.
Yeah. Ele está perguntando para a gente, na verdade, né? Ele falou que ele passa o minoxidil para os pacientes dele, mas lá na Malásia não tem tanta, né? Que no Brasil a gente tem talvez uma experiência maior ali em parte de estética, então a gente tem mais variáveis de tratamento capilar às vezes do que lá. Lá eles apresentam só o minoxidil 5%, mas o que eu estou explicando para ele é que aqui às vezes a gente consegue pedir ali a porcentagem que a gente quer. Se a gente quiser fazer uma porcentagem 3 ou 4%, a gente consegue. Lá eles não conseguem isso. Ele me falou que ele costuma passar para mulheres, por exemplo, ao invés da solução tópica, ele passa muito o gel, né, que tem a vantagem de não cair ali no rosto e às vezes poder causar um aumento de cabelos, um aumento de uma hipertrofia, né, causar barba ali em mulheres, esse tipo de coisa. Então acaba que ele não usa apenas o gel, né. E anteriormente ele tinha falado também que em alguns casos de FOE ele costuma fazer o FOE com a micropigmentação, a micropigmentation. E né, a gente faz isso aqui também, normalmente para aumentar a densidade em casos muito grandes, onde a gente tem, às vezes, a pessoa está aguardando uma segunda sessão, então a gente costuma fazer isso, né? And let's answer some questions about
Okay, so
from the
I've got a
people.
request
Yeah,
from some of them
yeah.
asking me to speak in my native language just to translate a little bit.
Yeah, let
So
me let me read these
let's
questions.
change our day. Now finally now we can read
Então
everything.
vamos ver. Para ter garantia do cabelo implantado ficar no couro cabeludo, procede? O que acontece, né? O transplante capilar, the hair transplant, né? O transplante capilar, eu não entendi muito bem a pergunta. Se puder mandar novamente aqui. Meu sonho é fazer o implante, entretanto ouvi um médico dizer que somente após os 40 anos. Ah, boa pergunta. E a paciente tem 34 anos, alopecia feminina. We have a question for a woman, and she asks about. She heard that a doctor said to her that she can only do the hair transplant after 40 years old. It is true? What do you think, Dr. Ali?
After 4 years old.
40.
40.
Just 40, just after 40 years old. This is not true, right?
Not true,
In,
not true.
in, então, né, para paciente que pergunta, eu tenho 34 anos, eu posso fazer o transplante capilar antes dos 40 anos? Pode sim. Né? Isso aí depende muito do transplante capilar, da própria calvície da paciente. E às vezes, mesmo pacientes que não têm calvície, mas têm talvez uma testa maior, ela pode fazer ali um rebaixamento, né, da linha anterior do couro cabeludo através do transplante capilar. Dr. Ali, do you do hair transplant to lower the first line of the hair transplantation for women? What do you think about it?
Yes, I think
Yes.
hairline repair is
Yeah, hairline
probably
repair.
my most preferred transplantation for ladies
Oh, cool.
because it really changes the way they look. We
Uh-huh.
get quite a lot of them whereby the front hairline is fading because of they tie their hairs up and it gets
Yeah.
It starts to have some traction alopecia. So bringing down or enhancing the hairline or reshaping that hairline a little bit does wonders for them. We get a lot of it in Asia, whereby the Chinese, Vietnamese community, they've got higher foreheads. So when we bring it down, they look very different, like
Oh, cool.
almost two different persons. It's very interesting.
More pretty, more.
Very, very confident. I've got some whereby once we're done, before that, when they take photos, it's usually taking at an angle. They like to take from a certain angle, like they're looking into the scenery and you see I'm in the Instagram photo, but you don't see my face. But now they would tie their hair up, they take front profiles, they take all different profiles to show off the whole frame all over again. They don't use bangs anymore. Previously, those with high forehead, they would comb their hair down, then they would take photos like this. But now, once they have the hairline, they would just bring it back up, and they want to be proud to show that, oh, look at my hairline, kind of thing, So
cool. Yeah, very good.
Let me take just 2-3 minutes, and I'll speak in my native language just to summarize all the few things.
Oh, okay.
Alright. Okay, selamat pagi semua. Saya Dr. Aly dan dengan saya Dr. Hudson daripada Brazil. Dr. Hudson, saya pernah jumpa dia, bertemu dengan dia first time tahun 2017 masa kita pergi training di Amerika. So Dr. Hudson adalah seorang plastic surgeon yang terkenal and dia menjaga 3 klinik di Brazil. So selain daripada rambut, dia pun buat semua pembedahan plastik. Dia buat semua things in plastik, daripada rhinoplasty, face, body, semua dia buat, breast, butt lift, everything Dr. Hudson buat. So sekarang kita tengah bincang tentang rambut, and kita baru bincang tentang minoxidil dan finasteride yang ada di negara kita. So and kita baru pun berbincang dengan hairline untuk kaum wanita yang mana ia penting. Untuk hairline untuk wanita, bila kita buat, dia akan nampak lebih confident, terutamanya bila dia nak ambil gambar. Tidak lagi dia akan ambil daripada sisi atau dari belakang dalam Instagram dia. Dia akan ambil daripada depan dan akan nampak cantik dan sangat menawan. Over to you. That's in Malay, our native language.
Oh, cool. Então, pessoal, o Dr. Ali estava traduzindo, né? Porque tem algumas pessoas da Malásia também que estão assistindo essa live, então ele estava traduzindo na língua dele, né? O que a gente teve de conversa aqui já. E um fato interessante que eu perguntei para ele é a respeito do transplante capilar em mulheres, se ele fazia muito transplante capilar em mulheres para reparar essa linha anterior do cabelo, para baixar essa linha anterior do cabelo. E ele falou que é uma das principais cirurgias que ele faz em pacientes femininas lá, que as mulheres procuram muito, e ele acha que é uma cirurgia que muda muito o rosto, muda para melhor, as mulheres ficam mais bonitas. E ele fala que muitas vezes a paciente, antes da cirurgia, a paciente chega, às vezes, as fotos no Instagram, né? Elas são mais, às vezes tira meio de lado, meio envergonhada, e após a cirurgia, ela já tira com o cabelo para trás e mais mostrando a beleza, fica bem satisfeita mesmo, né? Achei bem interessante aí essa questão dessa abordagem dele em mulheres, né? E deixa eu pensar mais alguma coisa aqui. Do you have some question, Dr. Ali, about? Yes.
So in terms of in Brazil, what's the trend? Do people do a lot of FUEs or they do a lot of FUTs? And how is it like with, let's say, influencers and let's say celebrities? Is it a trend for them to do hair transplants too?
Yes. The hair transplants here in Brazil are increasing so much maybe in the last 3 years. Yeah, and is increasing. And in my practice now, I do like 95% of my cases are FUE, automatic FUE, and 5% of cases are FUT with FUE, like a mega session. Yeah. FUT maybe just in women. Some women's we do FUE hair transplant. FUT, sorry. Yeah. Do you do FUT? No.
No. So in my country, FUT is reserved specifically for plastic surgeons. So I don't go into that area. We respect them enough not to touch it. But you're right. Actually, FUT has got its advantage, especially for women. And if we want to do a mega session, or if there's very little donor, I do encourage some of my clients to go into FUT if I feel that will actually be a much higher benefit for them.
Yeah. FUT, I think one of the great advantages of FUT is if you do FUT and FUE in just one session to treat maybe class 6, Norwood 6 patients. Yes, it's a good choice to make more hair for the patient. Ele está me perguntando a respeito do FUT, se a gente faz a técnica de FUT ou somente FUE, né? Eu falei com ele que 95% dos casos que a gente faz é de FUE e que o FUT a gente faz em pacientes femininas, normalmente a gente faz o FUT e a gente utiliza, às vezes, quando a gente quer fazer uma mega sessão, para a gente ter um maior número de fios, em pacientes que às vezes tem a classe, né, o grau Norwood 6, são casos maiores, então a gente combina ali os casos com as duas técnicas. O Dr. Ali, ele é dermatologista e lá só os cirurgiões plásticos podem fazer a técnica FUT. Então ele não faz essa técnica FUT mas ele faz a técnica FOE muito bem. Então, assim, eu acho que para ele fica tranquilo ali, que ele consegue cobrir todas as necessidades mesmo, né? Another question do you have?
Yeah. So some of my followers are asking what's FUT. So let me just do a quick recap. Because FUE is so popular here with all the follicular unit extraction. So FUT is the strip method, whereby the doctor will actually cut a length of scalp skin, remove that, and each of the hairs can be used with close to 95 to 99% extraction. But then they will stitch it back. Okay, so kalau dalam bahasa FUT bersamaan dengan strip method. Jadi dalam strip method apa yang kita buat, doktor akan potong sekerat kulit daripada belakang dan keluarkan semua folikel-folikel untuk digunakan untuk implantasi. Tetapi di belakang itu sebab satu kerat kulit sudah dikeluarkan, kita akan jahit semula. Dalam praktis saya tidak melakukan FUT atau strip sebab ia lebih kompleks dan biasanya dilakukan oleh plastic surgeon seperti Dr. Hudson. So I just told them that usually done by good plastic surgeons like yourself.
Okay.
So how do you see the trend in terms of transplant? Do you get younger and younger patients? Are they moving? Previously, the trend was like those in the 30s, 40s will be doing it. Do you see the trend moving into those in 20s? Like in Malaysia, I find the trend is moving to a much younger age, and although sometimes we say they're a bit young, but I find that no choice because today's world, image means something. So even if, let's say, I want to hire someone and both persons are equally qualified, or let's say this guy is maybe a 90% choice, but he's got hair loss. This is an 80% choice, but he looks good. High likelihood I might choose this because the package is there. I can train him to do that 10% extra, but this one, it's good, it's the marketing, the packaging isn't as good. So it moves into that. And even for a lot of them, the careers are very dependent. The confidence, if they're doing sales or if they're a public figure, like one of my very good patients, he's on with us. His name is Haris. So he's an Instagram celebrity. And for him, the image of losing the hair was a very big blow to his self-confidence. And he came by and now he's just beaming with confidence, even though it's still very early. So do you see that trend in Brazil where the younger ones are actually doing it too?
Yeah, but I think the hair transplant in Brazil, I think, is a new thing. So maybe most of the people is like most of the patients are in the 30s, but it's increasing the number of people lowest than 30s, the 20s people, and I think what you said is a very interesting and important indication for the patients today, because if you have a better image with maybe with a lower hairline in the 20s, it's a good thing for you. If you do a good work with a big hair density, I think it's very important. I think it's a good choice.
Yeah. I agree. I think that's very important that we need to. I think maybe 5-10 years ago, beauty was very taboo. People say, you're very superficial. You only see the outside. But these days, no, it's your image. And with social media, you want to see someone who looks good on social media doing the TikTok rather than someone who doesn't look good doing a TikTok. I mean, they're all right. The one who doesn't look as good must be extra entertaining. But the one who looks good just gets automatic views. People just want to watch you all the time and they enjoy watching you. It's come to that whereby to be successful, you have to be seen. To be seen, you have to be likable. So image,
Yes.
like it or not, is fast forming. Something that's important for both your confidence apart from your progression.
Yeah, yeah, yeah. Ah, então, o Dr. Ali, ele acha que é muito importante essa questão. Ele está perguntando se as pessoas com menos de 30 anos, elas têm indicação, têm procurado mais ali o transplante capilar no Brasil. E o que eu falei para ele é que tem uma tendência, a maioria dos pacientes maiores que 30, mas existe uma procura de pacientes com menos de 30, e que se uma linha anterior, às vezes, vai melhorar bem o resultado da imagem do paciente, eu acho que é válido, né, ele fazer o transplante capilar. E ele acha a mesma coisa, ele fala que lá na Malásia ele tem pacientes, às vezes, que são referências no Instagram, e tem aquele aplicativo TikTok que lá é muito usado, assim, então às vezes as pessoas são referências lá também, e elas estão sempre bonitas e estão sempre com uma linha anterior bem interessante, e isso às vezes acaba abrindo portas, deixando a pessoa mais bonita, mais confiante, e é um lado que eu acho que a gente tem que ver aqui no Brasil, que realmente hoje em dia a gente consegue fazer transplantes capilares com uma densidade maior, com uma densidade onde você dificilmente, né, percebe a naturalidade, né, a falta de naturalidade ali. Então, assim, consegue ter um resultado de como se realmente você nasceu com essa linha anterior, né? Dr. Ali, I have another question for you.
Okay.
Eu tenho uma outra questão para o Dr. Ali. Eu quero saber qual que é a diferença que ele faz na linha anterior dos cabelos para homens e para mulheres, se ele tem algum padrão, como que ele faz. Do you have different hairlines in your surgeries for women and for men's? What do? You do a circular for women and with the temporal increase in men. What's our technique?
Okay, so we'll separate between the males and the females.
Yeah.
We'll start with the females because that's a very interesting topic. So for females, largely would still fall the shape, the aesthetics of the head. So it depends whether because we're Asians, so Asians some of us have slightly broader face, or we have ovoid, whereby the top is round and then the bottom is a bit sharper. So it's all about reframing. When it comes to the hairline, basically, I just want to frame it and close down, especially the forehead, bring this down. So for ladies, we usually either do that moon shape that curls around, a bit like a heart shape, with a bit of a widow's peak, or some others whereby if their look is suitable with someone with a bit more power, then we actually give them same thing but with a bit of a design on the side here. Just bring this forward a little bit to give a bit of a triangle for the temporal angles here. That gives them actually that image of power. But if they want the image of gentleness and beauty, then we make it very gentle, straight, and then it just gentle curves off towards the side. I find that makes a very big difference based on their job and their personality. Are you gentle and loving, or are you someone who's going to be in corporate and needs a little bit of presence and power? So we do that for the ladies. Men, on the other hand, then it all falls back on what they want to do and how they are. So maybe we start with that. I'll do a quick translation for the ladies, then we'll come back to the men later. Ya, jadi kita bincang dengan hairline atau garisan rambut hadapan untuk wanita. Jadi dia ada beberapa pattern yang kita nak buat. Untuk wanita, kebanyakan bila kita nak buat semula garisan hadapan, saya akan memilih dua jenis pattern. Bergantung dengan bentuk muka wanita dan personality wanita itu. Kalau seseorang wanita tu ingin menjadi lebih ayu, lebih gentle, ataupun kita nak kecilkan muka dia, saya akan buat hairline yang membujur seperti heart shape dengan widow's peak ataupun penjuru di depan, dan kita akan buat dia gentle curve di tepi. Tapi setengah wanita yang mana dia jenis yang bekerja di korporat dan inginkan satu image yang lebih kuat, kita akan buat sama, dia akan curve tapi di tepi kita akan buat penjuru di tepi sini lebih tajam. Bagaikan nampak lebih jitu, lebih sharp, dan ada satu position yang ada kekuatan atau kuasa atau power dalam corporate ni. Over to you.
Yeah. Well, here in women's, I think I will start your methods for me. Yeah, for women's, I like your it's interesting. And for men's, I think that depends with the race and the style of the man. And some men's, the most part of the men's here in Brazil, they like the entrails in the temporal area, but it's not a reality for everyone. Me, for example, I don't have the entrails, and I have like a rounded hairline, maybe feminine style, but so you have to take the style of the previous hair, and you have to work with this. Ele perguntou pra gente aqui, né, e como que a gente faz em relação ao cabelo. Ele sobre a linha anterior, né, que eu tinha perguntado para ele. Ele falou que em mulheres ele tem dois estilos, aí ele faz um estilo para uma mulher que quer uma presença maior, ou às vezes para aquela que é mais delicada. Então ele faz algumas diferenças ali no tipo de linha anterior. E para homem depende de cada caso. Eu também estou falando com ele que para homem aqui no Brasil a gente faz normalmente, depende da linha anterior prévia do homem, para que a gente possa ver um estilo ali, discutir junto com ele se a gente vai querer uma linha anterior na região temporal mais avançada ou não. Isso é tudo discutido durante o procedimento, né? Well, I think let me see if we have another question. Queria agradecer aqui as pessoas que eu vi que estão presentes aqui. Eu vi que o Gaia está presente. Ana, muito obrigado. Agradecer aqui todo mundo. Vitão, obrigado. There's a problem with my camera. Ok. Tenho muita vontade de fazer um transplante capilar. How's your hair now? Hello, Harris. So hairline can make our face size looks smaller. This is a question from FGN Nafifa.
Yeah. But I think it's a very good question. It's a very good question. It does make the face look smaller because imagine if it's high up and if it's bald, then the forehead is wide. And if this is missing, like a lot of men who start to have hair loss, so the hair starts here, so then the forehead will look like it's this wide. So by changing the hairline, bringing this forward, so the forehead looks smaller, this looks smaller, it does change the overall outlook. But I'm not sure how you tell your patients. I usually tell them depending. So it's I don't always. A lot of them they want to go back and look as young as before. And I think that's the advantage of being from a country of Caucasian skin type. You guys actually look good with a little bit of a slight M, but with Asians we just look very old.
I see.
And our expectation is everyone wants to have that young hairline all over again. So it's quite challenging to repair some of the Asian hairs.
Yeah, it's interesting because now that you are saying this, I think it's not so common. I think it's not so common. If I see some Oriental people with the
Yeah.
yeah
Yes, not
yeah
common, not common.
yeah
So if they have that, they always feel that they are old. Whereas,
uh-huh uh-huh
so when I do repairs for Caucasian, I'm actually
uh-huh
very lenient. I don't mind. Let's say if they came with a grade 3, we will repair them to a grade
uh-huh
2 or a borderline 1 and 2 with a bit of an M shape, and they're very happy because they said, "I just want to look more defined. I don't need to look young." But with
uh-huh
Asians, we I always get, can I get this straight line across, which
uh-huh
can be
uh-huh
quite challenging because the
the
area is very wide.
less forehead. Ok.
Yes,
Ah,
they want to bring down the forehead a lot.
aham. Mandar um abraço para o Léo ali, né? Boa noite, Léo. E traduzindo aqui o que ele falou, é que lá né, nos países asiáticos é muito menos comum a gente ter, às vezes, os homens assim com talvez a testa um pouco maior, uma entrada um pouco maior. Os homens realmente eles têm a testa bem menor e quando eles não têm isso, eles se preocupam muito, eles procuram o transplante capilar mais rapidamente ou eles tentam fazer alguns tratamentos ou alguns cortes de cabelos que escondam mesmo ali a entrada ali, porque isso incomoda eles muito também, né? Just a question that
Okay.
I'm thinking.
Sure.
Do you know Elon Musk?
Sorry?
Elon Musk? Elon Musk from
Yes,
Tesla?
yes, yes,
Yeah.
yes.
Do you think Elon Musk did a hair transplant or no? I think so.
I think so. I think he did. And he looks so different. He looks good with
Yeah, from the
hair.
PayPal time,
Yes.
right?
From
Yeah.
PayPal time, he looks.
Yeah, 20 years before, he
Correct,
was
correct.
bald, more bald than now. So.
Yes. But I think it's also the face shape. So Elon Musk looks better with hair. If he doesn't have hair, he looks not as powerful.
Uh-huh, uh-huh.
But Jeff Bezos from Amazon, if he has hair, he doesn't look as strong as being bald.
Yeah, you're right. You're
Yeah.
right. Good
So
observation.
so I think for some people, looking bald is
Yeah,
strong for them.
yeah.
They've got a good shape. So
Uh-huh, uh-huh.
I've got clients. I don't want to do the transplant. I said, "You look good. I don't want to touch you."
Uh-huh. Oh,
Yeah. But some of them they need it because if they don't have it, then they don't look as prominent or as confident.
Yeah, yeah.
So it's a very subjective thing. Nice to have, but not everyone should have it, kind of thing.
Yeah, yeah.
But you're right, Jeff. Elon Musk.
Elon
Was
Musk. Yeah.
so much better with it. So much better. He's
Oh,
more marketable with the hair.
yeah, yeah. Eu perguntei para ele a respeito do Elon Musk, aquele, né, um dos donos do carro elétrico Tesla, né? E porque tem algumas fotos dele de alguns anos, 20 anos atrás, onde parece que ele era bem mais careca do que é hoje. Então eu perguntei para ele se realmente ele fez o transplante capilar ou não, o que ele acha. Eu acho que sim, e ele também. E ele disse também que muitas pessoas, elas melhoram muito assim com o transplante capilar, mas algumas pessoas elas ficam melhor carecas. Então ele estava falando sobre o Jeff Bezos, que é o dono da Amazon. E ele é uma pessoa que mais careca, ele parece mais poderoso e tal, e talvez para ele, se ele tivesse um transplante capilar, ele talvez não ficaria tão bom, né? And about Prince William, do you think Prince William, he is handsome with or without hair?
He needs hair. He's an
Yeah,
Elon Musk. He needs hair.
yeah, yeah. I think so too.
He's an Elon Musk category. He needs hair. I'm sorry, but I might get
Yeah,
shot
yeah.
tomorrow by the royal family, but I don't care. He needs it.
Yeah, I agree with you too.
Yeah.
I'm with you in this.
Okay, I've got one question for you.
Okay.
Because I've been teasing some of my followers. You're a good famous plastic surgeon. You're from Brazil. Brazil is famous for a lot. Somehow Brazil is famous for a lot of procedures that carries the country name.
Yeah, yeah.
You've got Brazilian wax, you've got Brazilian samba, you've got Brazilian butt lift.
Butt
And
lift.
I'm curious, what is a Brazilian butt lift? What is a Brazilian butt lift that is completely different from an international butt lift?
Yeah. Well, I think it's because I think this name is created in United States, but the reason I think it's because the women in Brazil used to have big butts. So yeah, yes, it's like a style, the Brazilian butt style, Brazilian butt lifts.
Okay,
But
okay.
yeah, but we do a lot of Brazilian butt lift here. Yeah, it's a preference in the patients. The Brazilian women's liked very lot liposuction, and they always ask, well, this fat maybe we can put here in my butt, and I have my butt bigger. It's a good thing. What do you think? So no, okay, let's do it. And so one more Brazilian butt lift. In Malaysia,
if
there's
there were more male viewers, they might take the next flight to Brazil just to check out the Brazilian women. Like, oh.
yeah. I think this is the reason that this name of the methods. And
Yeah, but it's very interesting. We don't have a Malaysian boob job or a Malaysian nose here,
no.
so hats off to Brazil for having a butt lift
Yeah.
name after you guys.
You
But
don't
it's a
have
very good marketing for the country.
yeah. You don't have a Malaysian butt lift. No.
We have Malaysian food. We got food everywhere. We are known for the food,
Malaysian
but not
food,
for
okay.
Malaysian food.
Oh, cool. Well, Dr. Ali, do you have another question or?
Let's see. No, I think most of our followers, we've answered most of their questions. Let me just double check, making sure we don't miss out anyone. Yep, I think we've answered most of their questions, at least for this session. Yeah, and I think maybe one more topic before we close today's session. Yeah. So, where do you see the trend of hair transplants? Let's say for the next 5 years, 10 years from now, and also for, let's say, those with very advanced hair loss, let's say grade 6, grade 7. Like in our case, we are seeing a combination and using transplants and hair replacements, because a lot of times we see those in grade 6, grade 7, they've got very high hopes. They've got probably the financial means to do it, but we don't have the donor hairs. And even with FUT, probably won't get past very much. Do you see a growing trend using transplants plus hair replacements as a combination for both?
Do you see hair replacement like body hair replacement or no?
Not so much, because like in Asia we don't have that much of body hair, so we're probably looking at using
like
a hair piece, a combination. These days hair pieces are getting more advanced, but using it combination, some amount of real hair, some amount of hair piece on other segments.
Oh yeah. I think this is a trend here in Brazil too. It's in the start. The people don't know a lot of micropigmentation techniques, so it's starting now, and the good micropigmentation is starting now too. So Yeah, but I think it's a great a great thing to do both things, no? Hair transplant and the pigments. And I think maybe in 10 years or more, we have like a culture of hair
Yeah,
in the laboratories, and
yeah.
maybe, yeah, I think it's we have existing research about it,
Mhm.
but I think maybe in 10 years
Yeah, might be
this
a
turns
lot
a
more close.
reality.
Yeah,
Yeah,
I
yeah.
look forward to that. I look forward that someday that with some amount of hair we can culture more hairs and
Yeah,
get
yeah.
to grow back those hairs. Yeah, so
Uh-huh, uh-huh.
that will probably be a very exciting frontier.
Yeah, yeah. I think maybe in 10 years this could be a reality.
Yeah, yeah, yeah.
Yeah.
Okay, Hudson.
Okay.
Should we close today's session?
Yes, yes. Dr. Ali, thank you very much for your time. Yeah.
Oh, no
Nice,
problem,
very
no problem.
nice to
Thank you
see you
so much.
again.
It's midnight on your side. I should thank you
No,
more.
yeah, no. And I will record this, and maybe I will put this in the Instagram and the YouTube to the people
Yes. So
watch. Yeah.
I'll put it there too,
Oh,
and
cool.
send me your contact so that if I get people who wants to go to Brazil, they might want to go for a month holiday and come back with a new butt.
Oh, okay, okay. They are welcome. Okay.
Okay.
Okay. Thank you
Have a
very
good night,
much, my
Dan.
friend.
All
For you
right.
too. Bye.
Bye.
Agradecer a todo mundo aí. Vamos encerrar essa live. E tenha uma boa noite a todos. E a gente vai deixar isso aí gravado aí para a gente poder assistir depois. Grande abraço.